Everyone, good afternoon, good day, good evening, from wherever part of the world from which you're watching us from. Um, I do think I do think there was a serious mix-up on the flyer for today. The flyer had reported 1 p.m. EST. I guess we were thinking that the time would have been adjusted and gone back to what it used to be, but no, we are still. It's not yet been adjusted, so it should be 2 p.m. EST, not 1 p.m. EST for USA and Canada. It's 7 p.m. in Nigeria and the UK, which is the right time at the moment. So we apologize for that mix-up, but we are so glad to still be able to come into your homes and be a part of your weekend on this Saturday live. Please invite your friends, let them know that the program is started. It's going to be very interesting. The things that we'll be talking about and sharing in the course of this week. All right. So don't miss it. Don't miss any session of the program for today. It's going to be fast and brief as usual. I think I've adopted that fast and brief method, and then I'm going to keep it at that. Right. Okay. So as you know, I will always want to. Yeah. Good evening. Mrs. Ajiri, good evening. Komeno, how are you doing? Good evening. Please help us to press the like button. Just push the like button right there on the page on YouTube as you are watching. If you can share, please share it on Facebook, share it. Um, I want to believe people are watching on Instagram. I cannot see anybody yet. Sometimes this Instagram thing can be funny, and you just think you're talking to yourself. Okay, somebody's liking on Facebook. If you're liking on Instagram, on YouTube especially, please click on the like. If you're watching, please click on the like button. Um, wow, where are we as regards COVID-19? It's really getting hot. I understand things are happening. We can't really help the things that we are seeing coming, happening these days as regard COVID-19. But as I will always say, please stay safe, take the necessary precautions, do all that you're supposed to do. Today, I'll be speaking on the program on what we have titled Fibroid and Fertility, Rethinking Your Options. And just like I said, it's kind of an explosive topic that I'll be speaking on today. I will want to enjoin you to please invite your friends and anyone that you think this may be of benefit or help to. I would want to talk to them about it. In the last couple of days, I've had, inquiries being made as regards people who are at the brim of losing their uterus. I've had cases of people who had lost their uterus because they had to operate on them. Had they had to go through surgery to deal with their fibroid. So we want to rethink the options. We want to look at what options are available to people. What can people do in the meantime to help themselves and to help their health? And these are the things that we'll be considering this week. But before I do that, I would want to um, share a few information with us. The first information is with respect to uh, the programs that we will be having, programs here at Nutraceutical Led Solutions. These programs will they are of great benefit. We completed the class for the Nutraceutical Led College. The college, we had a batch that finished in September rather. Another batch is going to be starting in the next couple of weeks. My advice is that please try to join this class. I finished the boot camp this morning, earlier today, a boot camp, a weight loss boot camp. And then somebody said something, then I was like, you only had part A of the solution. You did not wait to get the other part of the solution. Right. So some of you that attend our boot camps, programs, and the likes of them, that is just part A. You need to get a complete dose of what the whole picture is. And this is where we give the total picture. Some of the things we share, even those we share online, we do not have enough time to be able to share them, share a lot of stuff, right? So some of these things, you need to, hello, Joker's place, how are you, ma? Some of these things you need to come to class really to learn them. Some of the things we share, there are not things that we can share in 30 minutes or in 20 minutes or in 1 hour. Those people who attended the other class, like this course is a 40-hour course, and that's just the truth. So you want to learn. And I assure you that it's a worthwhile investment. The testimonies of those who had attended before verifies this, and they all testify to the fact that this is a class worth attending. And I can assure you it's not something you're going to regret if you do attend. Right, the numbers to call will be scrolling on the screen. You want to call this number on WhatsApp. Sorry, you want to send a WhatsApp message to this number. That is the registrar of the college is going to be able to speak with you and take you through the registration process. Um, of course, limited seats are available. It's not a mass production site class. So you want to kind of take those numbers down. For people who are watching or joining on Instagram, the number is 234-705-358-4066. Again, 234-705-358-4066. You can get into our DM and a message on, make an inquiry, and then we will respond. Of course, the flyer is also on our Instagram page. It's all our social media platforms. You want to get in there to get the necessary information that you need as regards this. Okay, I'll move on from here. The next, I'll be talking about this for today. And this has to do with the topic I'll be sharing on today, fibroids and fertility, rethinking your options. Now, I'll be having a 3-weekend boot camp only for people who have issues with fibroid and people who have issues with conception. And those conception issues will have to do with their fibroid cases. Again, I'm torn in between. I want to also take on people who have issues with blocked fallopian tube, which usually is a case of adhesion, and how to actually resolve that. This boot camp is going to be starting on the 21st, I think. Okay, yeah, it's going to be starting on the 7th of November, sorry, November the 7th. We're going to reel out the information. It's going to be scrolling through. It's going to be starting on the 7th of 3 weekends alone, 7th of November to 21st of November. Just 3 weekends for people who's got issues with fibroid and fertility, and those who have issues with blocked fallopian tubes, which is a case of adhesion of the walls of the uterus. So if you know anybody who these programs are going to benefit or is going to benefit you as a person, the numbers to call on WhatsApp are showing on the screen for those who are watching us on on YouTube and Facebook. If you are watching on Instagram, you can slide into our DM or go through our page on Instagram. You're going to see the flyers there, and then the information to process will be there, and you can actually use them, to help yourself. Please feel free to contact us on these issues. Good evening, Mrs. Tolu Olarinde. Good evening, madam. It's going to be an interesting 3 weeks. All I want, there is a kit, and then aside the kit, the 3 weekends is going to be like a DIY thing where I'm going to take you through what to do for yourself, how to be able to help yourself if you find yourself in this condition, because treatment may take between 3 to 6 months. And so we'll be able, finally, Mrs. Tara, good to see you. Okay, so we'll be able to undo this. You'll be able to know what to do to help yourself. But in 3 weekends, we're going to be able to do that. So just call the number that is scrolling on your screen, and they will give you information on what to do to register. Again, I advise, please, you want to call someone to please join this session. It's starting. I will have to go deep into it right now. Then I'll take it up from here. Okay, so we're talking about fibroid and fertility. Fibroid seems to be like something that is common, especially among people of color. Again, before the end of the year, I will be inviting you to join us online as we launch the Super Health for People of Color. This is a movement that is concerned specifically with the health of people of color, what they can do to help themselves. My major concern has been to talk to people of color. Because it bothers me when we are having conditions that are life-threatening. Some are not life-threatening, but some are life-threatening and they are avoidable. But some of these conditions are now being seriously linked, being talked about to affect people of color specifically. Tayo Ba, how are you, ma? Hello. We want to really be able to address and help people of color to know that for number one, that a person of color places you at a serious advantage if you know what to do and how to help yourself. And these are the things that we'll be talking about. So the Super Health for People of Color is going to be an advocacy for the health of people of color, especially using natural health and things that are natural to us as people of color. Most of these things are things that we are thrown away because of civilization. Some of them we've thrown them away because of religious beliefs, and which I believe were wrongly passed across, or they were wrongly received. And these things are necessary for our good health. And so we'll be looking at our natural heritage in terms of food, in terms of culture. We look at our herbs and things that are beneficial to our health as people of color, which are healthy alternatives to so many medical practices out there. And so this topic of today, fibroid, is one of the major topics that we'll be focusing on in that group. Fibroid is one, sickle cell is another one, high blood pressure is another one. All these conditions are just listed right now. When we look at the statistics across the globe, people of color are highly disadvantaged. As a matter of fact, when it comes to fibroid, out of 5 cases of fibroid recorded in the world, 3 of the 5 are going to be for women that are black women. And that is what research has shown. The New England Journal, which is one of the, if not the most reputable journal of medicine, had said this, and there's so many other journals had also corroborated the fact that people of color are highly disadvantaged, and they are most likely, black women are most likely to have fibroid. As a matter of fact, it's more common, is most common among women of color. So what is fibroid? We want to have a few definitions so that we can all have a proper understanding. You see, fibroids are tumors, and just like cancers, they are tumors. The only difference is that they are not cancerous. All right. And so they are tumors, and then you have the uterine fibroids, which deal specifically with fertility, and these are found within the uterus. So and these are the things that we'll be dealing with, right? So fibroids, uterine fibroids would grow within the muscles of the uterus, on the outside of the uterus. They hang in the uterine cavity, right? So we refer to them as uterine polyps when they are hanging there, or right. I mean, in some cases they are found within the cervix, right, of women. So you find fibroid within the cervix of women. And so they can range from microscopic size, that is, they could be so small in size, and some could be as large as you have found some like golf balls, and some could be as large as a football, a normal football size. I've seen fibroid tumors as that huge in people. And then they could come like in single forms. You have just one fibroid in someone, and they could grow like in multiples. They could be unitary and they could be multiples. And so it depends. So the way they grow, the way they present differ from one person to another, which is the reason that sometimes one size fits all may not be too highly recommended, because we need to take down the case in their specifics and know what exactly it is. Again, some people will tell you that, oh, I'm going to go all natural to treat my fibroid. I am not advocating that. I am not an advocate of that. And that is why the topic for today says fibroid and fertility, rethinking your options. The reason I said I'm not advocating that is that there are cases where surgery is just the only option. And I won't lie to you. So I'm not among those people who will tell you, okay, yeah, natural treatment, herbs, and all of that, we handle that. It is not in all cases. There are cases where surgery is the most recommended option, that you go in and they take it out. But after that, now before and after surgery, there are several natural things that you can do to help yourself. Now, I spoke earlier on that I'll be addressing women who have issues with adhesion or blocked fallopian tubes. Quite a number of women had their tubes blocked because they went for fibroid surgery and it was not properly done. It's not a question of even if it was properly done, but their bodies were not properly prepared, sufficiently prepared before and after the surgery. Now, whenever there's a surgery along that part, there are going to be scars. It's just like you have a wound and scars are going to form. Tissues are going to grow up to cover up the places where the surgery are taking place. Now, these scars, if the proper things were not done, depending on your body type, it's possible for these scars to grow. Now, the growth of these scars could block the tubes, could block your tubes. Right, so we call that adhesion, and so I'll be treating on natural ways to undo adhesion in that boot camp for the 3 weekends that boot camp is going to be done. So if somebody's having a blocked tube, so what are the options? What are the things to do? So how do we handle that? I'll be dealing with that within the 3 weeks of the boot camp. All right. So so surgery is not bad. It's not yeah, scar tissues, Dr. Ajayi, scar tissues, right? Surgery is not bad. It's not but knowing what to do, having the right information, Mrs. Fumla Shamo, you're welcome. Having the right information is so important. So these are the things that we will be presenting to you so that you have a proper understanding. So like I said, in some cases, it is inevitable. Surgery is inevitable in some cases. And I will just tell you, please go ahead and Mrs. Tinuke, it is well. How are you, Mrs. Tinu? Good to see you. Right, surgery is inevitable, but what do you do before surgery and what do you do after surgery? That are the things that we can also help you, and that bootcamp will also be able to help. All right, and again, one other thing about surgery is this: if you remove one, right, like somebody who is gotten multiples, right, no matter how much they weed and take out all the multiple fibroids out of your system, if you do not recourse to natural means of educating yourself properly on what to do and how to prevent a reoccurrence, in most cases, such people still find themselves having a reoccurrence or other growth would come. So I usually tell people that your uterus, just like it's a reproductive place, is fertile, and then it's like a field that is cultivated. You clear out a field. If you do not plant there and you don't go back there again to handle it, weeds are going to grow there. And so if weeds grow there and you take out the weeds, if you leave it open like that, by the next time you go back there again, weeds will have grown there. And this is what happens, right? So surgery will only remove it. When surgery removes it, if you continue the lifestyle and the things that you do, it's obvious that other ones could grow, right? So yeah, so it's so important for us to have a proper perspective and understanding that, look, I mean, when it comes to fibroid, a holistic approach must be taken. All options are on the table, and we're going to look at what are the things that we can do that can save life and then help save the uterus, help the people that are involved to be able to conceive. The only time you stop having the threat of fibroid is when you enter into menopause, and I will explain why that is so. That is so because fibroid actually is hypersensitive to estrogen, and estrogen and progesterone are two hormones that are very active during your reproductive years. So during your years of reproduction, when you are sexually active and then your reproduction is so possible, you have estrogen and progesterone. Your body is not sometimes able, which is the reason in most cases, when your body is not able to deal with the estrogen. People in most cases of fibroid will be battling with estrogen dominance. And what is estrogen dominance? I've said severally over this program that these two hormones, even as you are nearing menopause, they begin to decrease. Your estrogen level decreases about 10 to 15 years towards menopause. Your progesterone level will also decrease, and which is by the time you enter menopause, they stop and they cease completely. So when you enter into menopause, there is no fear of fibroid any longer. If anybody is experiencing a bleeding and unnecessary bleeding in menopause, then they need to see the doctor real quick, because that could be a sign of cervical cancer, right? Even in menopause, you experience bleeding. You need to see a doctor real quick. That could be an early sign of cervical cancer. So for women, once menopause is entered, your estrogen and progesterone level drops considerably, and then you do not have any fear for fibroid. But as long as you are still having your ovulation, you are still having your period, then you are at a risk of fibroid. And so you want to actually pay attention to what you can do to help yourself with this case. Researchers, like I said earlier on, they've also said, about the New England Journal, some other researchers at the National Institute of Health also said that reproductive hormones like estrogen, they appear to stimulate cells to release growth factors. Which is the reason for the excessive growth, and you see these growths and you see these fibroid cells. 2 months they begin to grow, they grow and they increase because of the growth factors that they produce from within. Right, I will not do well if I did not tell you that the uterine fibroids are in different types and different groups. So the more important reason to also understand that the treatment may differ. What we will recommend for one person may differ to another one. So I want to show a diagram that may kind of help us to understand that, as well. Okay. All right. So, I believe, okay, let me make it large enough. Okay. So you see the diagram. People who are on YouTube and Facebook will see the diagram. If you're on Instagram, I'm not able to show a diagram on Instagram. I've not gotten there yet. Maybe people do that. I'll try to get there. Right. So there are those uterine fibroid that grow in the innermost layer, right? In the innermost layer. I don't know whether I can. Oh, is it showing? Okay, right. You will see my mouse that is pointing to the diagram. So there are those, yeah, I believe you are seeing it. Okay. There are those that are growing in the innermost layer of the uterus. All right, that's the diagram of the uterus. And those ones are called submucosal uterine fibroids. We have the intramural, which are those that are growing in the middle layer of the uterus. Right. And we have those that are growing in the outer wall of the uterus, which are the subserosa, and they are growing in the outer wall. And then we have the pedunculated uterine fibroids. Those are those that are attached to a stalk, either outside of the uterus or within the uterine cavity. So we have the cervical fibroid. This is actually a very rare one, which you find by the cervix. You have those ones there. Then you have the interligamentous uterine fibroid, which are those ones that grow between the uterine broad ligaments. Now, so that is a picture of the uterus. So the fibroid is not limited. They could find their growth anywhere. So where they are found would also depend on how we undo them. So I've had people that because of having a pedunculated, a submucosa, they've had their tubes blocked. Some have had their ovaries removed. Like I said, in the last couple of weeks, I've had such cases of people who had lost one ovary, or they are being told that they are going to operate and then one ovary would go. Right. And so when the ovaries are already threatened, then chances of reproduction is also threatened, as the case may be. Right. So we want to look at what to do in the case of anybody who has found themselves in this. And like I said earlier, as a person of color, as a Black woman, you are at a higher risk among every other woman. And in my own studies, I would say a few things that are responsible. So that will lead me to talk about what could be responsible. Why do we, what aids in the growth of fibroid? And then if somebody, why are Black people susceptible or at a higher risk compared to other people? Already, I've listed a few things in subsequent videos that we have had, talking about hormone reset for women. If you have missed that, subscribe to our YouTube channel and go to watch those videos on hormone reset, where I'm about to talk about and address the issues of hormones. And fibroid is a very hormone-sensitive condition. And now, one thing before I go to reel out a couple of things, other things, is the fact that as people of color, this stands us out as compared to every other person. Our melanin pigment determines a whole lot about our response to several treatments and several conditions, either our reaction to conditions as it affects our bodies, or how we react to treatments, or how we react to medications, how we react to therapies. It differentiates us. It positions us differently. And so it is so important that whatever treatment that is being produced or being given to everybody, we have to understand that we as people of color, we are special and we are unique. We may react differently. We may not react to the dosage other people would react to. We may require a higher dosage than other people before it can work. And in some cases, we may not even be infected by what is infecting other people because of our melanin pigment. But in the case of fibroid, I would say that number one is the exposure, our lack of exposure, our exposure or lack of it to sunlight. Vitamin D3 deficiency plays a very strong role to people of color, and our reaction to medical treatment, our reaction to therapies, our reactions to medications, our reactions to disease conditions. Our melanin pigment and our exposure to sunlight plays a key role. And so these has to be considered. And now, women who live in the olden days and in the village, as the case may be, they are still open. They go out there and they're in the sun, and then they're in the sunlight. They get that early in the morning, and then they're well exposed to that. And so, but women growing up in urban centers do not have that same privilege. Not because they don't have the privilege, but because they choose not to. There are some women, by virtue of their job, the things that they do, their responsibilities will not allow them to have enough exposure to vitamin D3. And so the absence of that plays a lot of role in resetting the hormonal balance or upsetting the hormonal balance in women. And like I've always said, if anything would go wrong for any woman, it's one of the first things that will first be affected is the hormone balance. So this could explain why Black women are highly susceptible. They are at a higher risk as compared to other people. This same factor is responsible in the case of high blood pressure, because African men, Black men, are also at a higher risk when compared to other races and other people. So we want to look at all of these factors holistically and see how we can provide solution. Again, I mentioned in my previous videos the cases of early menarche. Menarche is the first period, the first menstruation a young girl has. And so if it comes too early, there is every likelihood that those kids that have early menarche will have issues with fibroid. Sciences are proving that. And so I also mentioned that in the previous videos I've had, is a reason for us to pay attention to how we are feeding our daughters, our young girls, because when we feed them to early menarche, we are feeding them to several health conditions as they grow up in life. Again, these days, issues of fewer pregnancies will also come to play. Of course, I do agree when it comes to birth control and family planning, but I also advocate for natural methods for this to be done. As more women are approaching and doing a lot of birth control these days, they are being predisposed to the fact that their estrogen dominance is going to be higher, because the more kids you give birth to, the more the chances of your body to be able to control estrogen dominance. Of course, progesterone will have to come to play. Of course, after the first 3 months of a pregnancy of a woman, progesterone have to dominate estrogen, because if that is not happening, if progesterone is not sufficiently provided, that person might not be able to carry that baby through the first trimester. And now, so that controls the estrogen dominance. But right, these days, 1 is enough, 2 is enough. For some women don't even want to have any kid at all. That also can be a factor. It can also be responsible. We are having cases of fibroid more common with women of reproductive age, but have not given birth. You have to just look at the statistics. We have more women of reproductive age, but they have not had any child. It's more common, right? Another thing is the high body fat content. So obesity is another factor. In several cases of fibroid, I'm not saying it's only people who have who are overweight. I've seen people that are even underweight that have issues with fibroid. I've seen people who are not overweight, who are, I mean, their weight is normal, yet they have issues with fibroid. And I've seen people who are underweight. But you have more people who have weight issues that present with fibroid. And then these other two reasons are one of the two major reasons that I think with lifestyle adjustment you can control. One of them is the exposure to xenoestrogens. And these are not estrogens, but they are chemicals that mimic estrogen and they find their way into the bodies. We dealt with this a whole lot under the topic hormone reset. You want to go back and actually watch those videos and how to see how the xenoestrogens find their way into your system, into your body, through plastics, through pesticides, through synthetic hormones in both meat and dairy products. You find them in dairy products, in meat products. You find them a lot. Hormone replacement therapy, oral contraceptives that people use, birth control. You know, all of these contain synthetic estrogen. They are not real estrogen. They mimic the real estrogen. These make people to get fibroid. We spoke about this a whole lot in subsequent videos. You want to go back and watch them. And then you want to pay attention to your body and skincare products because they actually mean a lot. Then the second one, which people do not really pay attention to, is poor estrogen metabolism. Now, your liver, as it's cleaning out and detoxifying the blood in your system, is also supposed to mop out excess estrogen so as to control the dominance of estrogen within your body. In most cases, so many people's body cannot do this. Estrogen is not well metabolized, so it gives room to estrogen dominance, which will in turn give rise to fibroid. So if you are going to look at fibroid holistically, these are major areas that we would want to pay attention to. So I will not do it today. Lastly, because of our time, I'm going to talk about what are the options, you know, but before I talk about the options, what are the symptoms, right? What do people feel? There are people that do not even show any symptom at all. They go through it and they do not have any symptom. Whereas some people go through it with symptoms. And some of the symptoms is that they feel full. Some people feel full within the abdominal area, making them to want to use the bathroom every now and again. Some people have excessive bleeding during menstruation, heavy bleeding. We discussed that also when we're talking about hormone reset for women. What is heavy bleeding? What is a heavy flow? Some people don't know what a heavy flow is. If you are going to use a tampon or you're going to use your pad, they're going to be using like more than two in a day. That means your flow is heavy. It could be a sign of fibroid. Excessive length of menstruation, people who have their period above 7 days. Now you bleeding for more than 5 days. I would consider a normal period to be between 3 to 5 days. The flow should be consistent. Some people have their own for 7 days. It's bleeding with lower back pain, with cramps. Some people have issues with painful intercourse. So during intercourse, the intercourse becomes painful. All these are signs of fibroid, and you want to pay attention to them as early as you can so that you can know what to do, and then you can actually undo them. Now, fibroid can impact on your ability to reproduce, like I've shown in the diagram, and you are still seeing on the wall. If it's growing in any part of the body, any part of the uterus, like you have seen, it could threaten your chances. Sometimes conception can take place, but it's going to threaten conception. Again, it's so funny that when conception takes place, what fits fibroids also fits the growth of the fetus. And so as the baby is growing, the fibroid tube might begin to grow. And during the time for labor, the fibroid could hinder the chances of having a success, painless, a smooth labor. So in most cases, the doctors want to tell you, let's take it out and do what we should do so that we can increase your chances at conception. So let me talk about the various options that that are available. First of all, I will talk about the options that are available medically and what have been done. There are two options. There are about 4 of them, but again, one is still exablet is still not very common. It's still growing. By the time it's common and it's available, that could be one very viable option. Studies are still not too high on it about what are the side effects, but I do think that it's something that can be done. It's an outpatient procedure where doctors would use an MRI scanner and through the use of the MRI scanner, they're able to target the fibroid cells and then target them and then take them out, and then it shrinks and then it dies. It's just like it's a non-invasive procedure. It's not surgery, so they use a scanner with the help of the screens, and then they're able to carry that is called exablet. Yeah, so that is not so common right now. Then the next one to it will be the uterine fibroid embolization. Embolization too looks like that, like the previous one. I said that one is common. It's very effective at targeting the various fibroids at wherever they are, and then it's been taken out. I know a doctor here in Canada who had spoken with me when I first got in. I would say, well, let's talk about what are the chances and all of that. And I said, well, I have a different way of addressing it. I appreciate your method, but I do have a different way. And now, two other procedures that are common is the myomectomy and then hysterectomy. And now both of these these are surgical procedures. One, we have to deal with the removal of the fibroid, and then once the fibroid is removed, they seal up the person, and then the person goes on with life. But without lifestyle change, there is the very high possibility of having fibroid grow back. It could grow, it could grow in another part of the uterus, but it will definitely grow back, except the person has a complete lifestyle change. So that's so as to prevent what brought about the fibroid in the first place. And the second method is hysterectomy, which is a complete removal of the uterus. And now when this happens, they are saying that, well, you are not talking about reproduction anymore. You are going into menopause before your real menopause age, and then no more estrogen dominance. All of that adds up. So that one could solve the problem. It's like saying somebody is having brain tumor, let us cut off the head so that the person will not have brain tumor anymore, or we remove the person's brain. In the case of this is what hysterectomy is all about, the complete removal of the fibroid. And some people also subscribe to this as their, as what they prefer to do, right? But like I said, you will need to rethink. Thank you, Candy Mike. We need to rethink all the options that are available. So these are the options that are available medically. But what are the options available, and what are the natural response to fibroids? Number one, as a natural health practitioner, I would always say this, that there is nothing you can do if you do not stand on these 2 feet, these 2 legs. And one of them is diet adjustment. The second one is lifestyle modifications. They are the 2 keys on which whatever we do is based on. And then the third one will be to supplement. But in the case of fibroid, I have option 1, 2, 3, 4, 5, about 5 things that you can do. Now, all of these 5 things are what I'll be taking people through, especially those that will be attending that 3-weekend boot camp on fibroid. You may want to join that boot camp if you have it, or you know somebody who has these conditions. It's a boot camp that you want to attend. I want to bring up the flyer for that again. Right. So the number to call again will be on your screen. You want to call this number to register for that boot camp. If you're watching us from Instagram, you can go to our DM, and then we'll get it connected for it, right? And then I also spoke about people who have adhesion, blood fallopian tubes, scar tissues that grow up in their tubes. We want to deal with that too. Again, one other thing that could cause that adhesion is D&C. If you have had a D&C before, it's likely you could have an adhesion. If you're having that, you want to deal. If you have had it, you're not even talking about any blocked tubes at the moment, because you are not even planning to have kids. You may want to join this class so that you can prevent and help yourself before that time when you will start having kids, before it gets too late. I'm saying that because of those people who probably have had have had D&C, before now. So you want to actually address that. So what are the natural options that we want to talk about? Number one, I was talking about your diet and your lifestyle has got to change. You want to pay attention to your diet. You want to pay attention to your lifestyle. You want to take out from your diet and your lifestyle the following things. Number one, reduce your exposure to those signal hormones, signal estrogens that are found in plastics, in pesticides, chemicals that are found in your skin and beauty care products. You want to deal with those that are found in meat and dairy products. You want to take them out completely, and then you want to help your body so that your body can help itself to heal and reverse. That might be the first thing. You want to avoid foods that are inorganic. You want to avoid unnecessary exposure to pesticides, herbicides, synthetic fertilizers. You want to use natural feminine care products. Feminine care products that are natural. There are so many that are out there that are not natural that would actually affect you. You want to do it with those ones and embrace a better and a healthy alternative when it comes to the feminine care products that you use. Your hair cream, your face cream, your toner, your shampoo, your conditioner, your colognes, your perfumes are things that we are talking about here that you want to pay attention to. Most of them would contribute to your estrogen dominance, and you want to deal with them. Avoid food. You want to avoid foods that are containing dyes and preservatives. You want to avoid all of those things, and then reduce your chances, right? And there are several of those tips, right? Of those things that are there. You want to pay attention to what you are feeding on. Your food must be food that are healthy, that are organic, that will promote health, not promote diseases. These are very vital options and alternatives that you will want to do. Okay, so there are a few things also that we will also introduce. Number one are those herbs that can help to cleanse your uterus, and those that can also help your liver to manage its blood circulation and blood cleansing. Now, blood circulation is so essential when we want to heal the health, when we want to restore the health of your uterus. So the quality of the blood coming into your uterus must be checked. Now, because of the level of toxicity in some people's bodies, it's a lot of pressure for the liver to be able to filter completely or effectively. So the liver is dealing with so much toxins that it cannot even handle the excess estrogen that is found in people's liver, in people's blood. So we want to help your liver, right? By first of all dealing with the kind of blood that is flowing, that is going through. So there are helps to do this. And these are the helps that we'll be talking about when you attend that 3-week kind of bootcamp, because there are lots of them, and we're going to use lots of them. Not one, not two, not three. I'm talking about up to like 10 helps that will be used. Some will cleanse your uterus, some will help your blood to be clean. Those ones that will cleanse your uterus are there because most times when some women shed, now you see women who have 5 days of bleed of heavy flow or normal flow, and then they have 2 days, or they could have 3 days of normal flow. They have 2 days of spotting. Now you are spotting because your body is not shedding. Your uterus is not shedding completely the unfertilized substance found in your uterus. So you still have some residues. The accumulation of those residues will make your uterus to be unhealthy. Now, this could give rise to the growth of so many things that are unwanted. Ovarian cysts could grow, the fibroid could grow because of these things. So we want to cleanse the uterus pathway completely and make sure it is completely empty. Now, this is a process that we'll go through. I will advise when to do it and how to do it. All of these are the things that will be in that DIY kit, because there are things that you have to do on your own. Then, number two, aside the herbs that will be used, there is even something. I'm talking with a company who manufactures that here in Canada. Instead of you swallowing the herbs, they have them developed into tampons that you can actually insert into your vagina, which is going to help, especially for people that are having adhesions. Now, so it's going to deliver these herbs directly into the place where it is needed in the uterus. So the adhesion, the scar tissues are going to be wiped out. Then whatsoever condiments are still remaining in the vagina or the uterus, will be emptied out through the vagina. I'm discussing with that company to see, because what they are quoting as price is crazy. I mean, crazy. And I don't blame them. They have a winning solution. They are the only ones I have seen so far that would deliver it in such a healthy format, clean format, and then you can insert like you are wearing your tampon, and then it's going to go in there and deliver those things into your uterus. So I'm discussing with them. As long as we get to talk properly, I will let you know about that. But for people who are coming to the bootcamp for fibroid and fertility, this is going to be easy for you to get. You're going to get that easily. Again, there are some other medications, herbal medications, supplements that can be used, and they will be of help. I told you there are about over 10 of them that can be used that will be of help. Another thing that we'll be discussing in that, which is also one of the solutions, like I said, is not one thing, it's a holistic one, is the use of some feminine massage, right? There are several of them. There are ones that you can do by yourself, and there is one that is called the Femoral Massage. The Femoral Massage. right? These are some of the massage that you have to do that can boost and enhance your uterine health. One, they're going to help your uterus to heal itself. They will help the healing process by helping the circulation and the detoxification within your uterus. At the same time, once that is done, like our study in anti-angiogenesis, right? It's going to be easy for your body, and certain herbs and supplements that you use to target the site of the growth of fibroid within your system, thereby starving them of their supply. And when that is done, they shrink off naturally. These are processes that we are going to go through. Now, I'm going to explain that in details, practical details, to people that will be in that boot camp for the 3 weekends that it's going to run. And the third and the fourth one, which we also say, is to use is what we call the systemic enzyme therapy. Now, there are certain pancreatic enzymes that can be used as well to target the growth of tumors in the body, and these enzymes can be delivered there, and then they can go there and actually stop the growth of tumors. They work in the case of anti-angiogenesis as well. They use almost the same procedure to work in the fact that once they're delivered to the site where the tumors are growing, they target those tumors and then they starve them of their source of supply, and then they shrink naturally. Well, all of these are solutions that are provided naturally. Now, I am not advising. Always listen to these things, like it's showing on your screen. On if you are watching from YouTube or you are watching from Facebook, we are having it shown there. We do not recommend that you can do this on your own without an expert advice. It's the reason for putting up this bootcamp for the 3 weekends that is going to run. Register for it. Call the number. Send a WhatsApp number to the number you are seeing showing up on your screen, and let them register you for the 3 weeks. I'm going to be taking time to deal in details and how to help you in those massage sessions that you're going to do. This is something that you should be able to do for yourself, by yourself, to help your conditions. Again, thank you for taking our time to be with us on the program today. This is where I'm going to stop for today. Why is this not allowing me to show the picture for the the boot camp, the college is going to run from the 31st of October to the 21st of November. This is a college I advise that you should attend as an enthusiast. It's the Enthusiast College, right? And then you really want to be there to attend that college. It has a whole lot of benefits. Please call the number that is showing on your screen as well for you to be able to attend that college, right? And speak to the registrar. The registrar is going to be on hand to receive you and give you the information that you need to attend the college. It's going to make you a healthy living, an enthusiast, and the faculty is superb. Dr. Ajayi is online. Is on the faculty of that college. He's an encyclopedia of knowledge. I mean, you can't even finish Dr. Ajayi's class. I mean, from elements to natural herbs. You know, I was hearing online people are saying that they attend programs and they get scammed. And I said, seriously? When I don't even have enough time to finish on what I teach people. I mean, I'm like, seriously? So please, you don't want to miss the college. It's whatever you are paying for it is not even worth the things. It's not going to be enough to compare with the things that you are going to benefit by attending the college. People that have attended before, the testimony will convince you. We don't do empty classes. We don't do empty sessions. Our sessions are sessions that by the time you are done, you will know that, yes, it's worth the investment. And you see the impact, not just in your own life, in the lives of your family members. Yeah, thank you so much. Thank you, Reverend Sumbo, right? Thank you. So many people are suffering. They are suffering. Yeah, that is why we are here. And we hope that they will take advantage of these opportunities, attend and navigate a natural health and wellness introductory class. Like you are saying, the topics there, body food dynamics, nature care. These are introductions to nature care. to food, fruits and vegetables, nature care, the elements. You need to learn how to use the elements in your favor. So people don't, I mean, there's a lot, right? Nature care 3, herbs in healing, and then my own approach that is called brush. I'm going to teach you on brush, how to use brush to reverse conditions and manage conditions. Then natural health, natural approach to skincare. Like I'm talking about skincare product, which is what most people are used to. They have no other alternative because that is what is common in the market, right? You want to have alternatives. That is the reason we were dealing with that class on natural health and skincare products. It's the ones that you can use and that can help you. It's a class on its own. You need to be there. And then the business side to this is also going to be taught. The very many business chains that one can actually develop. There is a whole lot of opportunity when it comes to health, natural health and healing. You want to learn the various sides that Dr. Jai, you are here. All right. Thank you. He says you deserve self-care. Register for, you got to register for it. So there's a whole lot. You know, I've seen people that have developed multiple streams of income just by attending some of these sessions. There's a line for food, there's a line for products, there's a line for services, several things that you can do, right? So coronavirus is making people to lose jobs. This is a job creating opportunity, a job creating movement that you may want to join. All right. So I will stop here for today. I really want to thank you all for taking our time to be with us. I'll be your host same time next week. Watch out for our flyers and our programs. Please, if you have not liked this program on YouTube, please do us a favor, like this program on YouTube. Just click on the like button. I beg now. Help our ministry. Let it go to the permanent side. Thank you very much. Until we come your way again, same time next week, please stay healthy and keep yourself away from any danger. Thank you. God bless you.